but things did come to a head around about
A couple of years ago.
a couple of years ago. We tried ramping up different types of medication that seemed to kind of keep symptoms in abeyance, but you weren't great. And in the end, we ended up arranging you to have this outpatient ECT treatment in this hospital, the same hospital as which you work.
Yeah.
And my recollection is that the course of ECT you had then worked, got you better.
Yes. Yeah, I think
Is there any question about that?
Yes. Or maybe I'm just going to get better.
Always got the rider that you hadn't got better anyway, although you were quite unwell and you hadn't got better up until that point, despite several months of different types of antidepressant treatment, one on top of the other very often. And so the ECT seemed to go quite well, actually. I mean, I think it's interesting to talk about the nature of ECT. I mean, for people who don't know, it involves getting an anaesthetic and an electrical stimulus applied to one or both sides of your skull. That induces a fit, which is there carefully controlled with muscle relaxant and a brief anaesthetic. It tends to last between kind of 20 and 30 seconds. But inevitably, I mean, people are going to feel groggy and possibly even a bit delirious after an anaesthetic and after an induced, however well controlled, epileptic fit. I mean, I think there's quite good evidence that that kind of grogginess, delirium you might call it, or just post-epileptic hangover might last for 2 or 3 days. I don't know how long you found it.
I mean, I never had any difficult experiences or unpleasant experiences in ECT. It was always very straightforward. There's never any problems with it. It's, I mean, the most recent course is probably the one it's easiest for me to think about because it's recent. It's very difficult to remember individual treatments. They'll just
they blur in. Well, you tend to get 2 or 3 a week over 2, 3, 4 or more weeks.
Blurred into one, and I kind of got isolated memories of going for it and having it, and not really waking up from it at all. But I think I did get during that, and I think it was because I was an outpatient that I was a lot more aware of the memory problems.
Yeah.
Because when you're an inpatient, as I think we were saying earlier, there's pretty much nothing to do and nothing to remember.
So yeah, and a day on the ward is much like any other day on the ward. So
exactly.
There's not much to remember.
So I was going home and I couldn't remember stuff, and I don't know if that mattered terribly much at the time. I don't think it bothered me very much. And it wasn't one of the things I was worried about before having ECT. I wasn't worried about the memory things because it never seemed to be a huge problem before. What I did find was that it lingered for quite a while after that. And I think probably it's quite difficult to know, isn't it? You don't know how long your memory or your thinking isn't normal, because again, you're in there, you can't actually tell. But I realised looking back, over the few months afterwards, looking back at my life, I thought, good Lord, what was I thinking? Why was I trying to do things? What was I possibly? Why was I thinking I could do things? Because I couldn't remember stuff.
Well, you were very keen to get back to work, and I think actually during that episode, which lasted for several months, before the ECT you went back to work, and that was not a good thing to do.
Yes.
And I think even after the ECT you went back to work slightly too quickly, didn't
slightly
you?
too quickly, and I should have,
even though you were on the mend, you still weren't.
I should have stayed off longer, but it's very difficult because you just can't see it, And I think that would be difficult for me again. I think ECT, I was looking at stuff that other people have said about it, and people seem to either be very positive about it or very negative. There didn't seem to be much of a middle way, but maybe mine would be more of a middle way, and I think it probably was, and who knows why. It was the most quickly effective thing that I've ever experienced, and I think I said afterwards I would have that again, and in some ways I'd rather have it early again rather than go through lots and lots of horrible drugs first.